Hey everyone, and welcome. Today we're going to dive into a topic that is just so important for men's health, but one that's, often kind of misunderstood. We're talking about the prostate gland. And whether you're here for yourself, for a partner, or maybe a family member, I promise you this knowledge is incredibly empowering. So let's get right into it.
To really get a handle on the prostate, it helps to think about its life as a journey. And honestly, the best way to picture that journey is with this simple little analogy. It's a trip from a tiny pea all the way to a ripe peach. This one idea is going to help explain so much about why prostate health becomes such a big focus as men get older. Okay, so check this out. At birth, the prostate is literally the size of a pea. Then, through the teenage years, it grows to about the size of a cherry. By the time a man hits his 30s and 40s, we're talking about a ping-pong ball. Then it keeps going. In the 50s and 60s, it can get to the size of an egg, and for men over 70, it can be as large as a peach. It's this natural growth that's really key to why symptoms can start showing up later in life. So where is this gland that's making all these changes? Well, picture this. It's a little chestnut-shaped organ, and it's tucked right below the bladder, kind of wrapping around the urethra. Its location is absolutely central to its job, and as we're about to see, it's also the reason for the kinds of symptoms that can pop up. So here's the game plan for today. We're going to start with the basics, what the prostate even is, then we'll get into the common health warnings you should know about. After that, we'll cover how it's diagnosed, what the treatment options look like, and we'll finish up by talking about proactive health and wellness. It's a clear roadmap to get you all the info you need. All right, section 1. Now that we know where it is and how it grows, let's dig into its fundamental role in the body. What is the prostate's job, anyway?
So, in the simplest terms, the prostate is a gland, and its main job is to produce this milky fluid that mixes with sperm from the testicles, and together they make up a huge part of what we know as semen. And this brings us to the two really vital jobs it has. First, that fluid it makes, it's not just for volume. It's actually crucial for keeping sperm healthy and able to do their job. And second, it acts as this really clever little valve. During orgasm, it squeezes shut the path to the bladder, which makes sure that everything is directed outwards. Pretty essential for reproduction, right? All right, so now we know what it's supposed to do. Let's talk about what happens when things change. And I gotta say, recognizing the signs early, that is one of the most powerful things you can do for your health. Generally, there are three main conditions we see with the prostate. The most common one is what's called benign prostatic hyperplasia, or BPH. That's just the medical term for that non-cancerous enlargement we talked about, a totally normal part of aging. Then you've got prostatitis, which is just inflammation, and that can happen at any age. And finally, there's the most serious one, a malignant tumor, which is prostate cancer. Okay, so we have these conditions, but what do they actually feel like? What are the real-world signs that should make you sit up and pay a little more attention? These are the key signals to watch for. And remember how the prostate wraps around the urethra? That's why so many symptoms are related to urination. Things like a weak stream, having to go to the bathroom all the time, especially at night, or that annoying feeling like you haven't fully emptied your bladder. More serious signs could be pain, or seeing blood in your urine or semen. And in cases where cancer might have spread, you might feel pain in the groin or spine. Look, if you experience any of these, that's your cue. It's a clear signal to go see a doctor. So, you've noticed some of these signs. What happens next? The whole diagnostic process might sound a bit intimidating, but I promise you, doctors follow a really clear step-by-step path to figure out exactly what's going on. And it usually starts with 3 key checks. First up is a digital rectal exam, or DRE. This is where a doctor can actually feel the prostate to check its size, how firm it is, and for any unusual lumps. Second, there's a simple urine test, just to look for signs of an infection. And third, a blood test to measure something called your PSA, or prostate-specific antigen levels. Let's break down these PSA numbers because they can seem a little confusing. A level below 4, that's generally considered normal. Now, for guys over 60 who already have that benign enlargement, even a level around 8 can be totally expected. But if you see a value over 10, that usually means we need to take a closer look. But, and this is a big but, it's super important to remember that PSA is just an indicator. Even something like inflammation can make it go up. It's just one piece of a much larger puzzle. And that's exactly why, if PSA levels are high or there are other warning signs, the definitive test, the one that confirms or rules out cancer for good, is a biopsy. This procedure is more than 90% accurate.
and it gives doctors the clear-cut answer they need to figure out the best path forward.
Okay, so once there's a diagnosis, whether it's inflammation, simple enlargement, or cancer, what are the next steps? What are the paths forward? The great news is there are very clear and established options for each and every condition.
The treatment plan really depends entirely on the diagnosis. For simple inflammation, a course of antibiotics usually does the trick. For that common enlargement, BPH, medication can help manage the symptoms, or surgery can be used to reduce the size of the gland. And for cancer, the options are much broader and really depend on the stage. It could be anything from just monitoring it closely, which is called active surveillance, to more intensive treatments like surgery, radiation, or hormone therapy.
Now, when surgery is the right path for cancer, there's this really fascinating comparison between the old school and the modern ways. Traditional open surgery means one bigger incision, more blood loss, and a longer hospital stay. But robotic surgery, with a system like the Da Vinci, uses just a few tiny incisions. That means a much, much faster recovery. Plus, the long-term outcomes for things like urinary control and sexual function also tend to be better. The big trade-off: it often comes with a significant out-of-pocket cost. These are the kinds of critical things patients and doctors talk through together.
Okay, we have covered a lot about diagnosis and treatment, but let's shift gears now to what is honestly probably the most important part of this whole conversation: proactive health. This is all about you taking control of your own wellness journey.
I absolutely love this quote because it just puts everything into perspective. The idea is that your health is sort of a three-way partnership. Your doctor can do their third, your genetics play their third, but that final, crucial one-third, that is completely in your hands. It's all about the choices you make every single day. So what do those choices actually look like? Well, the great news is they're not complicated. It's things like managing stress, getting some moderate exercise, even just walking is fantastic, and eating a balanced diet with less junk and more fresh vegetables. It's about choosing real whole foods instead of processed stuff. Think fresh, seasonal, and local. And maybe the most important habit of all, don't put off seeing a doctor if something feels off.
So at the end of the day, it really all boils down to this. Awareness and action are your best friends. Through early screening and just committing to your own proactive health, you have so much power to take charge of your well-being. Your future really truly is in your hands. Thanks so much for joining us for this explainer.